For the moment, unfortunately, we have 34 deceased children and more than 9,000 cases of measles. And if we search in the root of this problem, we can find a lot of causes. For example, 5 to 7% from the people are vaccine refusal. More than 10% of people are working abroad. So they are working mostly without legal forms, and they are not having medical insurance. So their kids, they are not having medical insurance, and they are escaped from vaccination abroad, and when they come back in the country, it's happening the same. Unfortunately, we have also problems. Now we have less problem with the supplies, but we had before. And we have also a problem because we have less physicians than before. We have, in the last few years, we had 14,000 medicine who went abroad and 28,000 nurses. And that was, it's a difficult situation because the number of the doctors and nurses who take care of children, it's lower. Another problem is the media campaign that make, unfortunately, evidence just negative image of the doctors, and all these problems contribute to lower confidence on the healthcare professional decision. And another problem is, unfortunately, the rapid changing of the national immunization program, that we hope it will be okay. In the last 3 or 4 months, the situation is better because a large number of children was immunized against measles, mumps and rubella. So we are having a better situation for the vaccination coverage. We hope we will manage. We are also having problems with the tetravalent vaccine. It was since last week when it arrived, the necessary doses. And this is a problem. We don't have the diphtherotetanic for the pregnant woman and for the 14-year-old children. We have, for the moment, promises from the health ministry that the situation will be solved soon and there will be funding. Also, we are waiting the vaccination law. The vaccination law, it's a tough law. It's not an easy law because it contains also punishments for parents and punishment for family doctors. This kind of punishment, will not come from the beginning. First of all, the parents will be counseled. After that, they will have a period of 16 days after their children go to the school. And in that period, they will be having again counseling. And in the first year after going to the school, they must make the vaccines, all the schedule. There will be circumstances when they will having to pay some money, and it's very important to understand for the parents, and we are addressing to the parents because it's important that they understand the suffering of their children, the disease. We are always talking about vaccines and vaccination. I think, like parents, like healthcare professionals, I believe that it's very important that the parents understand what are the side effects of the disease, of the infectious disease, how hard it is and how painful it could be for his child to be ill. So I consider that we need to make all the efforts for education of a large population, also for the healthcare providers' education. In the last year, the Romanian Association for Pediatric Education, the ONG that I represent here, launched guidelines for vaccination dedicated to family doctors. And now we're trying to launch the similar book, guidelines for the parents, because we consider that everybody needs to have on the table guidelines to make it easier, the process of understanding why and what is the beneficial of the vaccination and what is behind the risk that we assume when we decide not to vaccinate our kids.